It is the first time that the government or anyone from the government has claimed that the UK has passed the peak. We learned today from the Prime Minister that the UK has had 171,000 confirmed cases of the coronavirus. Yesterday, the death toll went above 26,000, and as of Boris Johnson's latest comments, we know it's approaching 27,000. That would make the UK's the third highest death toll in the world after only the United States and Italy. And yet Boris Johnson said at this press conference that the UK had succeeded in avoiding the tragedy which has engulfed other parts of the world. It did very much feel like he was claiming some level of victory at this event. The first time he's given this briefing in the 5 weeks since he was himself infected by the coronavirus and hospitalised. He commiserated with bereaved families, thanked the NHS staff who'd been caring for all those affected by it, including himself, and he promised, as we heard there, details of a plan to exit the lockdown next week. But I wouldn't expect any significant changes anytime soon. He gave a list of criteria which would have to be fulfilled before restrictions could be lifted, including ensuring that the health service is protected, that deaths continue to fall, that the infection rate continues to fall as it is right now. The key metric in all this is known as the R number. That R number is currently below 1. What that means is that every one person who has the coronavirus is on average infecting fewer than one other person. So the authorities want to ensure it stays that way and that nothing is done that triggers a second wave of the virus. With the Prime Minister giving no details on timing, but in a preliminary briefing by a spokesman earlier, he didn't deny the suggestion that the lockdown could continue until June. Unlike other countries like South Korea, like Germany, where widespread testing has proven to be a key part of keeping the virus under control, authorities here did not manage to deploy it in the same way. Now, one of the problems was there was actually a lot more capacity to test than actual tests being carried out. And one of the reasons for that is that health workers who were getting priority for tests said that the testing locations were simply too far away. They were either too busy to get to them or couldn't get to them because he couldn't get access public transport. But as you quite rightly say, it is one of a list of failures, not least the lack of availability of protective equipment for doctors and nurses on the front line. Boris Johnson today claiming a victory for the health service, saying that nobody who needed a ventilator was unable to get one or has been unable to get one so far. But already we're hearing from the opposition Labour Party and its relatively new leader, Keir Starmer, saying that it will be inevitable that there will be a public inquiry into whether the government's response to the coronavirus pandemic has cost lives.